a tooth concern could be maybe like an anterior open bite or an open bite on the side. It could be because the tongue is not functioning properly. And it's basically when the child swallows, they kind of have like a little anterior tongue thrust to when they swallow, the front teeth are like this and their little tongue kind of pokes through. So they swallow and their little tongue does that. And that's a tongue that we could retrain it to kind of just sit on the palate where it's supposed to and sit on the palate and do the ideal function when the child swallows, so that it doesn't poke out in between the front teeth and cause the open bite or whatever else it could be erroneously causing. I look at the tongue to assess the function. I also look at the tongue to assess how it's attached to the mandible or to the floor of the mouth. Sometimes the tongue is attached too tightly, or it's attached with a frenum that is a little too long or positioned a little too anteriorly, and that's called a tongue tie. I also look at the upper and the lower lip. I kind of pull down here. There's a little something called a frenum here and right under the upper lip, kind of like right under the nose in the vestibule. I look at those attachments, and basically I don't want there to be any tethered oral tissue. You also don't want any tongue ties, and basically you just don't want any tissue in the mouth to be attached to whatever it's attached to in a way that the tissue doesn't function ideally. You want there to be an ideal lip seal. You want the tongue to be able to sit up on the palate, and you want in the swallow for the tongue to be able to sit up on the palate and kind of press up on that palate every time the child swallows. And basically, if the function isn't correct, I can recommend and prescribe myofunctional therapy, and you can actually come here to Miami Designer Smiles. Both my husband Raul and I are trained in myofunctional therapy, and so are our two hygienists. We are all very good at assessing faulty tongue or lip and cheek function. And basically, if that is the case, I would recommend myofunctional therapy, or I could also recommend getting some type of frenum release, or getting that tethered oral tissue kind of loosened, either with myofunctional therapy alone, if I think it could be done that way, or we might need to have a little release done surgically. Typically in kids, I'm the one that performs the tie releases, and patients do very well with them, and they definitely have better function after. And there's a little discomfort, but with the proper recommendations that I make for after the therapy, the tongue tie release or the lip tie release, patients do very well, and they typically go back to myofunctional therapy the week after the surgery, and the patients heal extremely well, and I'm able to correct whatever it is that their dental concern was in the first place by optimizing the function of the tongue and of the lips.